Good afternoon, everyone, and welcome. Thank you for joining me today, whether you're watching live or you're watching on the replay. And I'm very pleased to have with us today a special guest, Brian Dowd, the Deputy Director of the Department of Community Health. And so I want to welcome everyone who is on and just give you a couple of little pieces of housekeeping. I'm going to actually turn my light on while I'm giving this housekeeping info, so forgive me, please. Let's see if that helps a little bit. Okay, that's better. All right, so you are watching either on YouTube or on Facebook in the Facebook group. You are absolutely welcome to ask questions, and how you would do that is just type in the chat box. So go ahead and let's just practice that and tell me that you're out there. Say hello. If you're watching on Facebook, you'll need to give Facebook permission to talk to StreamYard. If you're on YouTube, you're fine. I can see you. So let us know that you're out there, and we're going to dive into the questions in just a second. So again, a couple ways to participate. Type in the chat. Folks have sent me questions prior to. And I think, Brian, we're going to go. Is there anything you want to say before we get started? I see Heidi. Hello, Heidi. Thank you for letting us know that someone's out there. Hi, Patricia, watching on YouTube, and Heidi's on Facebook. Okay. We know that folks are starting to join us. Hi, Tiffany. Okay, great. And let us know again if there's an issue with technology. You know, we can't control these things, but so far so good, folks. I'm really pleased. All right. We're going to thank you for all the hellos. And Brian, can you see those hellos on your side?
Yeah, I can see them.
Okay, wonderful.
Yeah,
okay, great. All right. So hello, wonderful. Okay, great. Well, we're going to go ahead and dive in unless there's anything else we need to cover before we just, hi, Jennifer. All right, good. Glad to see everything is working. I love that. That always makes me feel better. All right, so we've got different types of questions today. And again, feel free if you don't hear your question to add a question later on. And again, Brian's being very generous with your time. Thank you so much. And I'm just going to go ahead and dive in here. So in terms of EVV, because that is the big news, there was an email sent out about a couple weeks ago talking about some changes to the EVV timeline for implementation. So can you clear up who that pertains to specifically? And EVV, has anything changed in terms of implementation and what we need to know in terms of any changes?
So that's a great question. So we did initially in our rollout of EVV, we had planned for a mandatory claims submission date of July 1st, 2021. So at the beginning of this month. As we went through the process, we discovered, you know, we've been talking to you folks and talking to traditional providers and talking to advocates every month, every day through our communication streams. And we really stepped back and said, hey, we may want to take a look at this, and we may want to take a look at whether or not we want to do mandatory claims implementation as of July 1st. We had several traditional providers that had not registered yet. We had family members that were approaching us and saying, hey, I self-direct for my whoever, my loved one. And I'm just now learning about this. And I need a minute. I need some time. So in response to that, what we did is we pushed out that mandatory claims edit date until 10/1/2021. We went to our leadership and went to the other leadership outside of DCH that we sometimes report to, and we got the okay to do that. We also put in some actionable steps for traditional providers at that point. So I won't go through that, but it's things like they have to register by 9 days from now, I believe they have to register by. And then every single agency has to submit a claim by the end of August in order not to go on prepayment review. A mandatory claims edit means that claims, which is a really great question, it means that you won't get paid unless you submit through EVV. Your workers will not get paid for CLS or PSS unless they submit and are compliant with EVV. So that's what a mandatory claims edit is. What it does is if you submit outside, if you were to submit directly to MMIS, if your fiscal intermediary said, hey, we're not going to participate in EVV, which none of the fiscal intermediaries are planning on doing. They're all moving forward with implementing EVV. But if any of them did make a decision not to and said, we're just going to continue to submit claims like we do now through GAMIS, then 10-1, we would not pay those claims. Now, that is not a problem in self-direction because none of the fiscal intermediaries have any plans not to comply with EVV. Now, let me just go ahead and talk a little bit more about what's going on. Each of the fiscal intermediaries have different processes and plans for implementing EVV. Acumen has their own system, which is the DCI system. And that DCI system is EVV compliant. And they are already well into the piloting process with our system, the NetSmart system. So they are already submitting claims. They're pretty much ready to go. What they still have to do is get everybody in their community, all of the people who work with them, who have chosen as their fiscal intermediary, trained and using the system. That's where their big push is between now and October 1st. But from a systems perspective, DCI is pretty much fully implemented. We don't have them in the fully implemented category yet, but they are very, very well into their piloting and testing. Continuum is choosing to use the EVV system sponsored by the state, or the NetSmart system, previously known as TELUS. So Continuum has, at this point, put all the employees into the TELUS system for EVV. They have registered for EVV. They're currently in the process of loading all the differential rates for each member that they have on file. Then they are going to get some scheduling work done in collaboration with their members. But right now, they are not actively working with and training the members because they're still getting all their information loaded into the NetSmart system. That's not a problem, right? Because what we said was you had to be registered by July 23rd. Well, they're registered. Not only are they registered, they already got all the employees in the system. So they're one step ahead from that standpoint. So their next big point will be working in August with you guys who work in Continuum to get you up and trained and use of system, able to still see all your information through the portal that you use now, which is their portal. So there's some connection work that they're doing in that field. That's where Continuum is. And they expect that training to start next month. PCG is still working with us to connect to the NetSmart system. They have their own system as well. And I know there's not a lot of people who use public partnership. I believe it's less than 100 folks who use them across all the waivers. But they are actively working with us. We have a meeting with them next week to hopefully finalize the attestation, our agreement. They've had a couple of lingering questions that we've had to get our legal departments involved in. But their system is fully ready to implement. We just haven't gotten there yet. As soon as they do that, they also anticipate training in the month of August to move forward. So from you guys' standpoint, it's really important to know that each of the fiscal intermediaries have a plan. They're moving forward with a plan. They're in constant contact with us. We have set meetings with them every other week. But honestly, I talk every day to Katrina and Nikki from Acumen. I talk every day to Miss Tally from PCG. And I talk all the time to the folks from Continuum as well. So there's several of us that are constantly working.
So back to mandatory claims edit. That only pertains to the fiscal intermediary agents and providers.
Yes, it pertains to the fiscal intermediary and the traditional providers. Now, those fiscal intermediaries that you have chosen have their own plans for ramping up. So you're going to have to work with them as far as what they need you to do to get prepared to get up and running for EVV. What happens sometimes is you guys come to me and go, I don't want to do what my fiscal intermediary is doing. Well, my advice to you in that is, I can give you the broader outlines, but in your choice to work with that fiscal intermediary, what you've said is, hey, I'm buying into your system and the way you do things. So if they need you up and ready and trained and signed in by X date, and they're not providing any other method or methodology to do that, you have the choice to choose to another fiscal intermediary.
So again, we're following the lead. We're following the lead of our fiscal intermediaries, otherwise known as fiscal agents, if we self-direct services. Correct. Okay, great. Okay, another question. This one came yesterday. Someone ordered one of the free phones, free government phones. I believe it was called Assurance, and they attempted to download. I guess it was the Acumen app onto the free federal phone, and it did not accept it. So. Anything to comment on that? Yeah,
I don't know about an Assurant phone. So the folks that we have been working with are the Lifeline people, and that's who we provide in our presentations. You can go on to the DCH EVV website and you can see the link for the Georgia Lifeline phones. We have, those are not refurbished phones. They are not cheap phones or old phones. They are, I want to make sure, because I'm getting something saying somebody can't hear me.
Yeah, Katrina, can you hear? Hi there, Katrina, by the way. It's been a while. Can you all hear us? It might be on your end. Let us know if you can hear, folks. I think we'd have... It might be on your end, Katrina. Anyone else, just let us know if you can hear what we're saying. Sometimes there's just a couple seconds lag, but you definitely should be able to hear. So back to the free phones. This is with TELUS. Thank you, Tammy.
Thank you. We're working with a federal company, a federal group that is the Lifeline phones. We have verified that those phones work with the EVV app and system. They are new phones. They are not refurbished phones that come from Lifeline. And I'm also very happy to report that we have worked out with them that any data that is used as part of EVV does not count against the free minutes that are provided with the phone, right? So some folks have come to me and said, hey, even if I get this free phone, I may run out of data minutes if I'm scheduling doctor's appointments and everything else. Well, even if you run out of those free minutes on that Lifeline phone, EVV will still work because the data associated with EVV is exempt. So I would just point you back to those Lifeline phones as opposed to the other federal. There's multiple agencies out there that provide free phones, but the one that we have been working with are the Lifeline people.
Okay, great. So regarding COVID funding or funding that came during the pandemic, there was a 10% increase in funding that was to start in March that came from the federal government for waiver recipients. Any updates on when those funds will be available for use? Do you have any information for us?
So I'm going to need you guys to tell, because I believe that has already been the Appendix K work that was associated with that temporary rate increase. And
exactly, that's what it is.
It is a temporary rate increase. It was my understanding that that was already loaded to PAs. I don't know if it has been loaded into the EVV system yet. That was something that was lagging, but they were working on that last week to be reflected in EVV. But my understanding is that is already on PAs for the now and comp waivers and should be available. Okay. So if that's not the case, somebody, I'll follow up with Marilyn and our systems people after this call, but that's not my understanding.
Okay. So here's one from a provider agency. If a provider organization doesn't necessarily provide CLE services or other services that are required under EVV, do they still have to register?
No. If you're not, EVV is solely for PSS and CLS. So
Right.
personal support services and community living supports, whether that is provided in the now and comp waivers or the elderly and disabled waiver, the independent care waiver, whatever, that is solely for that purpose. If you provide CRA or CAG or anything else, then there's no need for you at this time to enroll in EVV. If we do expand it to other services, EVV, we will communicate well in advance any expansion, and there are no plans to expand to any other waiver services at this time. We are looking at non-waiver services, but not waiver services.
So on that previous question, it looks like some folks have received the temporary increase due to COVID, and some folks have not. So just want to acknowledge that, that's what folks are reporting out there. In terms of, and this is a very basic question that I know that you've answered a million times, Brian, but regarding EVV, could you clear up the rumor that the GPS system is attached to an EVV once an employee clocks in?
Yeah, so, and I don't mind answering this question a bunch of times. It's fine by me. So the GPS is active at the moment of clock in and the moment of clock out. And that's the requirements, the federal requirements from EVV. Any other time during the day, the GPS locator is not active. It is the time the person clocks in and the time the person clocks out. It's not that it's active. What happens is at that moment, it takes a GPS stamp. It says, This person is here at that time. Think of it like a stamp. They're here. And then when they clock out, it goes, they're here. The stamp doesn't go down at any other time except when you click that clock in and when you click that clock out. That's the only time the stamp goes in. And I've had tons of folks come to me and say, well, Brian, I don't believe you. I mean, I've had people send me text messages telling me I'm lying. They flat out say you're lying. We know you're tracking this. And I'm like, I don't know how to assure you that I am any more than telling you that. And they'll say to me, I'm going to turn my workers' phones to airplane mode after clock in. And right before they turn to clock out, I'm going to turn it back on. You know what I've said? Knock yourself out. I don't care. Because again, we're only doing that stamp at clock in and clock out. So if you want to turn to airplane mode so people can't track you or whatever else, that doesn't, to me, it makes me know, never mind. If you think of it like a time card, we're doing a time card when you come in, but the time card is saying, hey, the person is at this location. And at time out, we're doing the same thing. Otherwise, it doesn't really matter.
Okay. All right. So that's good to hear. So based on that question and just in that EVV vein of thought, as we're all learning the system, those of us that self-direct, occasionally someone may forget to clock in, clock out, or they may 6 months from now. And we are asked to go in and actually manually enter the time as a historical punch, which is fine. And we're asked to pick a reason code. And so will that be somehow reported back to you all? If, again, will we get any grace in the next, say, 6 months or so for just continuing to learn about EVV? And we are going to make some mistakes.
Yeah, so absolutely. And I've told this story a million times too. When I was growing up, I worked wasn't my first job, but one of my earliest jobs was when I was still in high school, was working for record stores, right? I worked, for those of you who grew up around here, I worked at Peaches and Coconuts, Record Town, and Tape World. Those were big record stores back in the day. And we had a clock in and a clock out. And I was absolutely terrible about clocking in. Like, I had a problem with it. No joke. I would forget to do it all the time. I would just come in and start talking or working. And then I'd be like an hour later and I'd be like, oh, crud, I forgot to clock in. And then my manager would have to do an exception to me clocking in and get an extra hour added. And eventually I got to the point where they actually like wrote me up when I was like a senior in high school and was like, Brian, if you don't start clocking in and clocking out, we're having to do too much administrative work on you. You know, we're going to take further action. The EVV system is pretty much exactly that same thing. If you have an exception here or there, no one's even going to pay attention to it, right? We understand that not everybody is going to remember to clock in and clock out all the time. We understand that there may be instances where the worker shows up and their phone is dead because it ran out of power. We understand that there are things that happen. If they happen and it's an anomaly, or it doesn't happen that much, or it happens a lot in the beginning, then that's not even going to trigger anything that makes us go, oh, this is a problem. No one's even going to really follow up on that. We get all that information, but there's a big difference in that happening and every single time somebody clocks in and clocks out, that there's an exception code given, right? If that persists for weeks or months, then we're going to have questions.
Okay.
We're going to go, okay, why? What's going on here? Do we need to help with training? Do we need to help with starting over on how you do this? Is there some reason why? Do we need to switch to IVR, which is telephonic? Is there some reason why you repeatedly have these issues? And of course, in the beginning, we realize, and it has happened in every state that is implemented, that there's a learning curve, right? So every state that has implemented this program sees a lot of exceptions in the beginning, and then it goes down, 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 down until there's a bit of a baseline of exceptions. And we totally expect that here. We don't expect people to be perfect in their first 3, 6, 8, 9 months. We only expect it when you know everybody's had a chance to get up and use it and move forward.
Okay, that's really good to hear. So this next question is from a provider. How do you account for EVV when a participant is asleep?
So there is ways in there's certainly ways in the NetSmart system, and I know there's ways in the DCI system as well, for if there's not a family member or somebody who can clock out, who can acknowledge the visit and the member is asleep, or let's broaden it to the member not just being asleep. Let's broaden it to the fact that the member is, unable to sign in and their family members aren't there because they're getting dropped off at a CAG or whatever else. There is an ability to do an exception to that rule. So you can do that exception to that rule and say that the member was not available to clock in or clock out at that time.
Okay, that's good to hear. Also, this question I received several times, and it is about rounding up. So here's the question. DCH has still to explain the rounding algorithm. Does DCI, which is Acumen's portal, round up to the nearest 15 minutes at the end of the week, pay period, day, shift, or what? I'm concerned about the rounding for 2 reasons: loss of minutes that add up to hours over the course of a budget year, and rounding causing an employee to go over 40 hours per week.
So you really need to address that back to DCI and Acumen, and I'll get with them so we can put out some guidance. What the truth is, and I've said this in multiple town hall meetings, so I have clarified this on more than one occasion, probably 8 or 9 occasions, that the way the system is configured now is if you go a minute over, this is the way GAMUS is configured. If you go a minute over, it rounds up to the next 15-minute unit.
Okay.
So if you go 16 minutes, it rounds up to the next 15-minute unit. And we've identified that as an issue, right? For all the reasons that this person just said. This is the example I've used on multiple town halls and explained multiple times. If you have 4 units a day for 5 days a week, let's say you get an hour of CLS a day. I know it's very unlikely, but just roll with me, and it's an example, y'all. And you go day 1, you go a minute over your hour. So now you're at 5 units. And you do that Tuesday, Wednesday, and Thursday. What happens when it gets to Friday? Right? Really, you've used up all your Friday units. Now, your units may calculate by the year or the month, but it's the same principle. If you're using an extra 15 minutes every week, then when you get to the end of the year, you're going to be short on units, right?
Exactly.
And you really didn't get the time because you're rolling up all the time. So what the department is doing in response to that is, and we're in the process right now, and we'll put out some banner messages and information on our website about it shortly, and we've put in a change order request with EVV, is to use the Medicare 8-minute rounding rule. So we will be going to for the waiver services that do 15 minutes, we will be going to the Medicare 8-minute rounding rule, which means less than 8 minutes, it rounds down, more than 8 minutes, it rounds up. And you, as an employer, need to comply with that. So you need to let your employees know that that is the standard rule, and you need to account for it as such. So we'll have that information out to you shortly. Sorry, the garbage people are here. So if that is really loud, I apologize. It should be over in just a second. But so we'll have information out about that. And as part of my to-dos from this Facebook group, I will follow up with the fiscal intermediaries to make sure that they are also on board with the same methodology and get that information out to you guys as well. Okay.
So speaking, again, along the lines of time, are employees allowed over 40 hours a week? Is overtime permitted?
Nothing's changed about our overtime rules. So I would advise you to go back and look at your policy manuals that are associated with the overtime rules associated with what your individual waivers are. So there are allowances for it in instances of the person might be institutionalized or otherwise it'd be a crisis. But as part of being a functioning self-directed member and not using a traditional provider is, you should be able to account for not having regular reoccurring overtime. That's in everybody's policy manual, right?
Okay.
If you are in an emergency situation or something happens, we understand that. But your plan should not be overtime. That should not be your plan. Your plan should not be, well, I have one worker and I'm going to work this worker overtime, because that is not supposed to be. It violates our policy.
Okay, so I see some questions popping up, but I'm going to go through just a couple of these and then we'll get to everybody.
And guys, I won't cite the chapter and verse of P&P manual on overtime. So that's not something I'll do, but I'll be happy to set up a one-on-one with you and we can go through how you operate your program. So I'll be happy to do that if you want to do that. So feel free to write me, and I want to give that to everybody out there. So if you feel like you need to spend some one-on-one time and we really dig into how you're doing your work as it relates to self-direction and we can really look at it, I am more than happy to do that. I have probably spoken one-on-one with about 150 self-directed members so far, and I've been able to get a heck of a lot of clarity on how policies and procedures should be done. So it's been very educational for me, and I think it's overall strengthened the program quite a bit.
So will there be additional training then for families that self-direct?
There's going to be additional training on a lot of points for self-directed families.
Okay.
I've said this in other meetings as well. I've heard all kinds of things, guys. I've heard people telling me that they pay for travel time, that their person clocks right now. They pay when the person leaves their house and they quit paying them when the person leaves home. I've had multiple people tell me stories of things like flex time or extra time, where they bill in extra hours for their workers to pay for bonuses or for meals or other things. I've heard families tell me that they don't have to have a schedule. They're exempt from schedules because they're self-directing. I've had families tell me that they don't have to document anything. They're not required to do documentation. They're not required to list down tasks. I've had several people curse at me over the last 2 months because basic principles around Medicaid, I've literally just walked through them with it. And I get it. I get this as a change, and it's a big change. And there's a lot of angst and a lot of anxiety and a lot of fear out there that is kind of being generated. But that's why I've already had discussions with the Department of Behavioral Health and Developmental Disabilities and that team that does self-direction. I've had talk with our own waiver staff at DCH. We're going to be doing some, after we get up and running in October, we're going to be doing some comprehensive retraining on self-direction, both in the elderly and disabled waiver and in the Now and Comp program, just to make sure that nobody gets in trouble or nobody has any issues just because they heard something somewhere else that something was okay.
Okay. All right. So that's good to hear. And I'm hoping that you all decide to offer that virtually as well. Sounds like
we will. We usually do.
Okay. Great. Okay. So again, what if a parent, I'm going on the self-direct side, asks a support coordinator if what they're doing, XYZ, whatever it is compliant. And the support coordinator says yes. And then it turns out it's not compliant. Who is ultimately responsible?
Well, so you as a self-directed member are responsible for all of the information that is available. So all of the policy manuals, I have talked to some really incredible, the flip side of what I just said is I've talked to some incredibly well-informed parents over the last several months as well that do participant direction as well. And they will cite me all kinds of stuff that's not only in their specific waiver policy manual, but they'll cite me stuff from the Part 1 policy and procedures manual, which applies to all Medicaid providers and members, which is fabulous because I got traditional providers out there who attest to the fact that they have read the Part 1 policy manual, that when I talk to them on the phone, they're like, Part 1 policy manual, we don't even know what that is. And I'm like, oh no. So there are some really, really, really well-informed parents out there. So let me say this, fraud, waste, and abuse is really why EVV was put into place. There were concerns in home and community-based services about fraud, waste, and abuse, right?
So what is considered Medicaid fraud? If you could, I know that seems like a very basic question, but so often we hear Medicaid fraud as the medical company that defrauded with millions and millions of dollars that hits the news. So what is Medicaid fraud?
So Medicaid fraud is the willful attempt to take something out of the Medicaid program that you were not entitled to or that was outside of policy, right? So the big point of it is there has to be intent. So you have to say, we have to, when we're doing OIG and when we actually, like the Medicaid Fraud Control Unit, who we affectionately call MFUCU, when MFUCU actually prosecutes somebody, right? Because people get prosecuted, y'all. Folks go to jail for fraud. Not participant direction members. I mean, there have been some cases in the past, but mainly it's traditional providers where this happens. They have to have a plan together on how they can take money from the taxpayers via Medicaid that they were not entitled to. So, for example, they knew that they should only bill for 2 hours and not more than 2 hours a day. And they were in there documenting that their worker was doing things when the worker had gone home. If you're sitting there, and this is just me being my normal, honest self, y'all. If you are sitting there and you are fabricating documentation when you know that the person is not there, the person's not delivering service, the person went home two hours ago, and you're making up documentation to say that that worker is still in your house and still delivering services, that is fraud, because you are going in and fabricating something for the purpose of receiving more taxpayer dollars than which the service was developed. If the difference of that is, if you were under the impression that you were supposed to clock in 15 minutes early and 15 minutes late to do travel time, and you're documenting travel time, that's not fraud, right? That's you going, hey, I thought this was appropriate, so I was documenting travel time. That's an education and retraining piece. So that's the easiest way for me to explain it. I will say this, our policies and procedures are available to everyone. They're publicly available. All the policy manuals are, right? You can go in and look at what CLS service requirements are.
Okay.
That's always out there for you to look at. I hear a lot of things where I go, where did you get that was a policy? And I will hear, my neighbor told me, I'm part of a group of family members that talk regularly, and they said they started doing it, and their support coordinator told them it was okay, or their neighbor or cousin or brother told them it was okay. I would encourage you to really be one of those family members that keeps on top of policy manual updates. When we update our policy manuals at DCH, we do a chart at the beginning of the policy manual every single quarter. We only update them quarterly, so 4 times a year. And we outline for you at the beginning everything we have changed: page number, citation, wording that is exactly changed. So it's not a big lift once you get used to the policy manual, because then you're just looking 4 times a year to see if anything has changed, and what has changed is clearly outlined for you.
Okay, so, and that will be, I'm guessing that will be all included in the training that will happen sometime this
yes,
fall.
yes.
Okay, great. All right, so we've talked about fraud. What about audits? Do audits affect providers and individuals who self-direct services, and what's involved and what kind of thing triggers it, or does something trigger it?
So when you're dealing with taxpayer dollars, which is what we're dealing with here, there are a million different audits. So I'm also part of the audit is what I do. So it could be a federal audit. So we have federal audits that are the payment error rate measurement audits. That's called PERM. PERM randomly pulls cases out of the entire Medicaid universe. And they look at the case from beginning to end. So they literally start with, should this person be Medicaid eligible at all? And they look at all the stuff that goes into Medicaid eligibility. And then they look and say, hey, we paid for all these services, and it's for a specific period of time. Should we have paid for these services? They look at documentation. They look at codes. They look at how much you were paid. They look at every single aspect to make sure that it is correct. From there, if the federal auditors, and these are not people that work from DCH, they are contracted people that come in and do the PERM audit. They give us a statewide error rate at the end by program. But individually, what they do is they ask for the money back. And it could be under self-direction, or it could be under traditional providers. If they see instances that they believe to be fraud, they send that to our Inspector General. There are other audits. There are state audits. Our legislature sometimes comes to us and says, hey, there's an audits department within the state. They say, we want to look at the following 5 programs. And then the state auditors come in and do a comprehensive audit. There are routine audits that are associated with quality metrics in the waiver, where we look at how services are being delivered. There is our own Inspector General, an office of the Inspector General that I just had a meeting with at 11 o'clock this morning, where they look at different categories and different programs to make sure there are not fraud, waste, and abuse in those programs. And then the other real way we see audits is if somebody reports somebody as being non-compliant. So we have a hotline for traditional and self-directed members that can call if they think somebody is frauding the taxpayers or wasting taxpayer money. They can report that agency, and that triggers an audit. Any of these audits are open to members, and our Office of the Inspector General will have full access to EVV information as well. So they will, it helps them actually in their auditing, because there are certain things that they have to get on paper now that will be captured by the EVV system.
Okay.
Excuse me. So that's all the auditing. There's a ton of auditing that comes with Medicaid.
So bottom line, know the policies, know and follow the policies, because those of us that self-direct, we're ultimately responsible as employer of record. Correct?
True.
Okay. Okay. So let's take, folks are asking questions here. The trainings that we're talking about in the fall, how will families be notified of the trainings? Also, how should daily documentation be done? I don't know if you can answer both of those questions, but.
Yeah, sure. So we'll push out any training that we do through all the normal channels. It will go to the support coordinators. We will also put it on websites. We will put it on our website. We'll put it on our Twitter. We'll put it on our YouTube channel. We'll put it in all the normal places about self-direction. So we'll use every available avenue we have out there for training. How daily documentation should be done, it is actually covered in the Part 1 policy manual, but at a minimum, and some of this stuff, here's the good part about EVV, because a lot of it is now going to be captured by the system that always should have been documented on paper. But what always should have been documented on paper is when a service unit starts, when the service starts for the day, and what the individual tasks that member was doing during that time, and when that service stops at the end of the day or the period in which the service commences. So, I typically see documentation that is, Brian is receiving services. The aide helped with bathing and cooking and helped with room organizations, taught whatever skills that they were teaching for the day or whatever else. That documentation is included in the service note. Right now, I know in the NetSmart system, there's like 67 or 68 tasks you can choose from, so that you don't have to do that documentation anymore. You just click off those tasks that you did during that service period, and that stands for what documentation you were doing during the day.
But at this time, we have some type of documentation, whether it's hard copy notes in a binder or something like that.
Correct.
With all that information, basically, we're okay. Okay, so Deborah asks about the Appendix K additional funds are not showing. What should we do if we do not see those funds yet? What do you recommend?
I would recommend that you talk to your support coordinator and or the Department of Behavioral Health and Developmental Disabilities if you're a now and comp recipient, because their beacon system loads the units. Again, I will follow up as part of this email to let folks know that we did hear some individuals did not have their funding loaded onto their PA.
Okay, thank you. And here's from Nancy again. Nancy was so excited to come on, Brian. She really was looking forward to this. She says her punches have been rejected. The employees have had punches rejected because of overlap with the next employee. Is that more a question for the fiscal intermediary?
That is a question with DCI, because that shouldn't be an issue if the overlap is valid.
Okay.
So that shouldn't be an issue. I would direct that back to DCI. And then if DCI has questions, like I said, I speak to Katrina and Nikki from Acumen every single day.
And Kathy's just letting us know that she's in favor of training as well for this. Very much in favor of the training that you talked about here. We've got several positive comments here on the training. All right, so let's see. How long do we have to keep records? Is it 6 years or 7 years? It's in the policy manual. Okay.
Yeah, but it's actually 5 years.
It's 5 years. Okay.
I think it's wait a minute. I think it's 3 years unless there has been any hearing or audit, and then it's 5 years. But I'd have to check that. But it's definitely in the Part 1 policy manual. And it's either 3 or 5 years.
This is a very long comment, but it just brings up one question about about the waiver renewal, the now comp waiver renewal, and some of the changes. And she is specifically asking about behavior supports and self-directing behavior support. So, given that, have those changes gone through CMS? Has Georgia received approval? If so, when will they start? Or when will it start? Nothing?
The waiver renewal is still pending with CMS.
Okay.
That's as much information as I have right now. They've asked some questions, and we have returned some answers to them, but it is still pending with CMS at this point.
So if someone continues to self-direct behavior support services, can they do that until we hear from CMS? Or no?
Well, the way the waiver works is we continue the old waiver until the new waiver is approved.
Okay. So and Joyce says, why can't we have the notices be given when changes occur? I have to look 4 times a year. I've been told I have to look 4 times a year.
Yeah. So the good news is it happens the same time, right? January, April, July, October.
Every quarter. Okay.
Every quarter it happens. So if you make yourself a reminder every quarter to go in on January 1st, you probably don't want to go in New Year's Day, but January 2nd, October 1st, you click on that policy manual, look at the front from our policy manual page. It'll tell you if and what has been changed.
Okay, so let's see here. I think this is the comment concerning fraud, but they feel the documentation has not been performed to their satisfaction, which also tends to be subjective. How is that willful or intentional fraud? Not quite sure the full, yeah.
So the good news about any, from the OIG perspective, any fraud determination or any kind of follow-up that is associated with that, you are afforded an opportunity to present your position. And you are also afforded the right to a fair hearing. So those are your avenues. If you tend to feel that it's subjective and then it's not willful or intentional fraud, then you can certainly present that case as it moves forward.
So Nancy, going back to the overlap, she says there's a 3-minute overlap, I guess, with the app that she's using. Is that unusual?
You really would need to discuss that with the FI.
Okay.
So go back to the FI, and if they have an issue, I'm sure they'll reach back to me.
So folks, I think those are all the questions. Any other questions that folks have? Again, it sounds like the training is been received with very favorable comments. So we're all looking forward to that. Okay. What is the biggest change occurring? Oh, the biggest change occurring in October with EVV.
The big change occurring in October 1st with EVV is that all claims for community living supports will need to run through EVV, whether that be DCI, whether that be, and I can't remember the name of the public partnership system, or the NetSmart system. Any one of those three, the claims for CLS or PSS, if you're on for PSS, need to run through EVV.
All right, we have one more question, and then folks want your contact information. From Deborah, please repeat the 8-minute rule, please, which you said will come out in terms of guidance at some point soon.
Less than 8 minutes, it rounds down. More than 8 minutes, it rounds up.
Okay.
That's the rule. Less than 8, it rounds down. More than 8, it rolls up.
Okay, so
My
Brian's
contact
contact. Yeah.
information is my first initial and my last name. B, I'm surprised anybody doesn't know it at this point. Some of y'all are calling my work cell phone at 9 and 10 o'clock at night. I would respectfully ask that you not do that. I have received several calls on weekends from my work cell phone. If I've given you my number and told you it's my work cell phone, that is my work cell phone. It is always on me. But unless it is, and really, I don't handle emergencies, right? Emergencies are a 911 thing. So I would respectfully ask, I start most days around 7:30, and I end most days around 5 officially. I'm often working more time than that. But even if I'm emailing you at 9 o'clock at night, I would respectfully ask that you contact me during normal business work hours if you have my cell phone. My email address is my first initial and my last name, which is bdowd@dch.ga.gov. So it's yep, there it is. Thank you, Rita. That's perfect. bdowd@dch.ga.gov. That is my direct email that comes to me. I will tell you, I get somewhere between 300 and 500 emails a day, and that is not an exaggeration. I know because I was touring a facility yesterday morning, and when I got back to the office at 1 o'clock, I had 213 emails. So I only tell you that to say that if you don't immediately hear from me, and it gets to be a couple of days, don't feel like you're being rude if you re-engage me and go, hey, Brian, I need to make sure that you see this email, because that is really, that sometimes, oh, this person did write me and I meant to get back to them. So it's a good reminder for me. So don't feel weird about that.
Okay, and this is for you, Brian, in terms of, we'll just end it on this very positive note with thanking you for your time and answering all of our questions this afternoon. Again, thanks to all who are participating live and those who are watching on the replay. And thank you so much, Brian.
All right, 100%. Everybody. I appreciate, just like Rita said, I appreciate all y'all's input. It really helps make the program better. So thank you.
Thanks, everyone. You all take care, and we'll see you again next time. Bye-bye.